Hi. Okay. Do you mind if I ask you a few questions?
Yeah, no problem.
Okay. So it's going to be pretty quick. I'm just gonna ask you a few questions about your day-to-day life, and that should be it. So I'll start with the first question. Um, what does your daily routine consist of?
So this is considered the coronavirus stay-at-home things, or like if you were out and about.
Like normal life.
Normal life, okay. Well, typically I'll wake up and take care of my dogs really quick, and then I would go to work at the digital media center, and then I would go to class, and I would come home and just like do some normal cleaning things, or then I would go hang out with my friends and then get ready for school the next day.
Great. Um, Do you like the ability to use drive-throughs?
Yes, I do. I typically do use a drive-through more than anything else.
Awesome. Do you or someone in your immediate family take medication regularly?
Yes.
Great. And how do you usually get your medications?
I usually drive through CVS now that I'm thinking about it.
Awesome. So would you be able to describe to me your usual experience at the drugstore?
Yeah, so typically I'll drive up and like wait a second, and then they'll ask for my ID and my birthday, and like it's pretty quick. And it's typically really cheap because of insurance, so it's not a bad experience. It's pretty good overall.
Awesome. Um, what would you say is the most challenging part of getting your medications?
I think the most challenging part is the communication with my doctor, because some medications require them to see me um, before they refill it. And my doctor is in Montgomery, which is 2 hours away. So that's very difficult for me. Sometimes I'll even go like a month without taking my medication just because I can't afford time off work or school to go to the doctor and in Montgomery. And so sometimes it's really difficult, and I would say that is the hardest part about obtaining medication.
Wow, that sounds pretty hard. Um, well, what would your ideal way to get medications be?
My ideal, okay, let's see. I think I would most likely love having doctor's appointments that can be held over the phone. Like if there's not something they're actively checking, um, I feel like having a doctor's appointment over the phone is completely ideal. And then the communication between like a doctor to pharmacy would be a lot more quicker in that stance. But I think pharmacies have pretty much already hit the ideal. It's just the communication between doctors that is difficult.
Great. We just have three more questions. So the next question is, would you rather save money on delivery fees and pick up your own prescription instead?
Um, yes, I think so. I'm gonna say yes.
Okay. Do you feel there is enough time in the day to pick up your prescriptions?
Not every day, no. Maybe on the weekends, yes. I'm a pretty busy person, so sometimes it is difficult. I can go about 5 days without picking it up. But I mean, I have to work.
Right. Um, if there was a solution to help convenience this process on a scale of 1 to 10, how much would you be willing to pay for that tomorrow?
I'm gonna say it depends on the cost, but if it's like under $10 a month, then yes. The scale, I would say like 10.
Okay. Awesome. Well, I think that's all the questions we have for you. Did you want to add anything else or did you leave anything out?
Um, I don't think So, do you need my name and occupation and stuff?
Oh, yeah, sure. You can say it now.
So my name is Bentley Harden. I'm a student at UA. And was there anything else?
I think. Oh, and what's your age?
Oh, and I'm 21 years old.
Awesome. Okay. Perfect. Well, thanks so much, Bentley.
Yeah, no problem. Have a good day.
Thanks, you too. Bye.
Bye.